Well, COVID is on a surge again. In India itself, there have been 3,961 cases. Clearly, if we talk about the national capital where we are, the total cases stand up to 483, and in 24 hours itself there have been more than 47 cases that have been reported, even though yes, 82 have been discharged, recovered itself, and in the last 24 hours there has been one death also that has been reported because of COVID. Now, to talk more about it, the do's and don'ts, the symptoms, the precautions, we are joined by a very senior pulmonologist from Indraprasth Apollo Hospital, that is Dr. Rajesh Chawla. So my very first question to you would be, was COVID always there, or suddenly in the month of May we've seen a surge and a spike?
See, we keep on seeing COVID-19 cases all throughout the year, but sporadic, once in a while. But now, since there is a new variant has come, which is more infectious, so we are seeing, first we saw a lot of surge in cases in Singapore, Hong Kong, China, and then now in India, we always report first in Kerala and then it spreads to the whole India. And now we have 4,000 around cases all over India. And this is basically because of the Omicron variant, which is JN1 subvariant, which is responsible for the illness. And this variant is peculiar, like it only causes the mild symptoms. Majority of patients which we have seen is very, very mild symptoms like sneezing, nasal discharge, body aches. And interesting thing is, many patients are having GI symptoms, diarrhea and vomiting. Loss of taste also in some of the patients. So these are the common symptoms now, but most of them are very, very mild.
So predominantly in the year 2020, when there was a two-year lockdown, the most cases or symptoms were loss of smell and loss of hearing. Loss of smell and loss of taste. Now you're saying it is one of the reasons, but is it still predominantly there, or there are other symptoms that is making rounds?
See, there is not much difference, but less loss of smell and taste. And as we see more, will be more clear. But usually it is influenza-like symptom in most of the individuals as of now what we are seeing.
And as a doctor yourself, should the patients, the people, because there's a surge that we are seeing, should the patients panic? Should they be vigilant? Should they be calm? What message would you want to tell our viewers or patients who are watching you on TV now?
One is that if you have influenza-like symptoms, it is important that you consult your doctor, and there is no harm in getting it tested. And if you get it tested, then at least you can prevent the spread of infections to others. If you're not getting it tested and you have influenza-like symptom, please wear mask. That's extremely important so that the others don't get infections. And there is no need of panic, but you need to be very, very vigilant and taking care of yourself little extra so that you also don't become one of the patients.
I'll also be asking you, as a patient or as a viewer itself, many might see if I'm sneezing or coughing, I would go to Google and search these are the things that I should be doing. But according to a senior doctor like you, what do's and don'ts would you advise our viewers also, that one should be doing this, one should not be doing that?
One is, if you have comorbidities. What I mean by comorbidities is diabetes, hypertension, coronary artery disease, previous stroke, any illness, malignancy, post-transplant, on chemotherapy. If you have any of these comorbidities, you need to be even more vigilant. Then start wearing mask if you go to a busy area, particularly in malls, hospitals, you should. And if you don't require to go, don't unnecessarily go to an area where there is a lot of rush and there is a chance of exposure to other individuals, because many of these people may be asymptomatic and they may spread infections. So that's, and number two is, if you go to these, then you must wear mask. That's extremely important. Third is that you must wash your hands, because it is important. We should inculcate this habit in our day-to-day practice so that whether there is COVID or no COVID, the other diseases also you can prevent. And and if you have symptoms, you must wear mask and try to get it tested and consult your doctor. So these are the very important thing which one must follow, because and there is no need of panic as of now. And whatever deaths, whatever seriousness has occurred, that is predominantly because of the other diseases and that patient, and incidentally they were found to have COVID-19. But it is not that every patient will be mild. So one of the odd patients can get serious. So it is important that you should take precautions, and whenever there are more number of cases, even if it is mild.
And my very last question before I wrap up. Now, Delhi has also seen 483 cases till now. Do you think Delhi is COVID ready? The hospitals are COVID prepared? They're all ready to face it?
I think so, because everyone knows that when such an emergency arises, there is advisory from the government. And yes, all the hospitals are prepared. And this has occurred many times. So every hospital knows what they need to do when such an eventuality occurs. And the areas have been marked. They have issued local advisories according to the hospital. So we are prepared if that kind of, but I don't expect the way it is going right now.
Thank you so much, Dr. Rajesh Chawla, for speaking to us. So yes, viewers, that was Dr. Rajesh Chawla, who is a very senior pulmonologist who spoke exclusively to NewsX and shared what are the do's and don'ts, what the people, the public should be doing. And we also urge our viewers who are watching us on television right now to be very vigilant, but be calm. And yes, like he said, precaution is necessary and one should be doing that. This is me, Brian Andrew Thomas, signing with camera person Ankush for NewsX, Delhi.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.